Hi guys, my name is Emily Morgan and I am the sports medicine teacher here at CEC Early College. I'm sorry we missed you for the open house, but I wanted to make sure to reach out to you and just give you a couple of tidbits of information about what sports medicine is and what you can expect from this class if you decide to come to CEC, which I hope you do, and what kind of things that we kind of go over. So just a little background about me. I am an athletic trainer by trade. So if you've ever played a sport or watched a sport, I'm one of the people that runs onto the field when someone is injured during a sporting event. I've seen anywhere from just minor sprains and strains to open fractures to concussions. And so sports medicine is a little bit of that. And we primarily go over how to diagnose these injuries, how to treat these injuries, and then eventually you learn how we can prevent these injuries from occurring. Some examples of some projects that my students have done in the past is my students have gone over how to prevent ACL tears. They normally go over the definition of these injuries and how they occur. And then they go into more detail on who sustains these and how we can prevent them from occurring. Other examples of projects that we have done is last semester, students did a concussion awareness project that they got feedback from industry professionals. They created a presentation that shows what concussions are, how concussions are sustained, and they did them in both English and Spanish if they wanted to. They also went over signs and symptoms. How concussions occur. And why symptoms need to be reported. They also tried to get rid of common misconceptions or myths around concussions. And then they also went over how athletes can come back to play after a concussion. They ran all of this information through our district athletic trainers. And we're able to get feedback from actual athletic trainers on this. And then these athletic trainers are then able to use this. They were able to actually take this information that these students created and present them to their athletes. So our students created the information that a lot of our athletic trainers are using in the district as well. So really cool comparison there. Our students also learned both this semester and last semester about how to do telehealth evaluations. They pretend to be the doctor, one of them, and the other one pretends to be the patient. And they ask questions and do a telehealth video evaluation on these patients as well. This is just a short example. I won't play the whole 7 minutes.
Hello, my name is Gladys and I'm from the athletic team here. What's your name and your influence? So, what can you say to me?
So our students practice these regularly in order to be more familiar with these as well. When we're in person, other things that we go over in sports medicine are we learn how to tape ankles. Okay, we learn how to do a lot of different tape jobs to help prevent injuries and support injuries. We go over CPR and first aid, and you leave the class with your CPR certification. We learn how to take blood pressure, pulse, and respiration rate. And we also learn how to test for these injuries on the field. So we learn special tests as well. Next year, we're also hoping that students who leave sports medicine will leave with a patient care tech certification, meaning that you could go and work in a clinic as a patient care technician as soon as you finish sports medicine is the goal. Other than that, that's a really quick overview of a lot of the stuff that we do in sports medicine. If you have any questions, please feel free to reach out to me through the email that I sent this. And if you'd like to schedule a one-on-one meeting with me to discuss this class a little bit more, I'd be more than happy to meet with you one-on-one as well. I hope you have a good day, and I hope you choose CEC because we're the best place to be.